This video specifically is about the description of derangements. Thinking derangements, thinking obstruction to movement, directional preference, centralization. Types of derangements. We have a posterior derangement, again reading directly from their manual. A posterior derangement is a term that is used to describe a spinal derangement. Do not confuse the term derangement with a disc protrusion or herniation. This is a derangement, mechanical obstruction. People with a posterior derangement have a spinal derangement that have a directional preference for extension procedures. Posterior derangement, extension. Home run. Anterior derangement, you see where this would be going. The term is used to describe spinal derangement that have a directional preference for flexion procedures. When you're documenting an anterior derangement, patients centralize with flexion procedures, flexion in sitting, flexion in lying. If I'm classifying a derangement, classifying that derangement with a flexion responder as an anterior derangement. Some derangements have a directional preference for combined directions and are described accordingly: posterior lateral, anterior lateral, etc. Pain locations of derangements. The pain location is categorized under three big headings: derangement pain, central or symmetrical, unilateral or asymmetrical above the knee or elbow, right? This one's directly from the lumbar spine, so we're using unilateral asymmetrical above the knee. Also think above the elbow. Unilateral asymmetrical below the knee or below the elbow. Those are the pain locations specifically to the derangements. So anterior derangement, posterior lateral or anterolateral, and central, just the different. Okay, this is a derangement. They have pain. Central, symmetrical. Central, unilateral pain above the knee. Down the right leg above the knee. That's central, unilateral, asymmetrical. So don't get confused on the terminology. Primarily using that for the test-taking procedures of the McKenzie certification.